Hello, everyone. Good afternoon, good morning, and good evening, depending on where you're watching me from. And today, I want us to discuss briefly on what CPR is all about. CPR is not a new topic to us, and I believe we all know the basic concept of CPR. Today, we are going to look at the practical session of what CPR is all about. And CPR simply stands for cardiopulmonary resuscitation. And when we say you are resuscitating something, it means you are bringing something back to life. And when we say cardio, cardio stands for hearts, and pulmo stands for lungs, or pulmonary stands for lungs. So cardiopulmonary resuscitation, it means you are trying to bring back to life the heart and the lungs. So there are some conditions that so many conditions that you can actually perform a CPR. And some of these conditions include, we have drowning, we have electrocution, we have unconsciousness, we have after a road traffic accident and maybe the heart is affected, and maybe the person is unconscious. There are so many heart related conditions where you can actually also perform a CPR, or any condition at all that affects or compromises the integrity of the heart and the lungs. So now, how do we perform CPR on victim? Like I've said earlier on, how you perform a CPR, it actually depends on the intervention you administer to a victim. It actually depends on the condition. In RCA, in drowning, there are some safety tips that you have to ensure first before you continue with your CPR. In RTA, that is road traffic accident, you need to ensure that your safety and the safety of the victim is paramount. In fact, in every emergency condition, but how you apply these safety measures actually differs. Like in RTA, you need to ensure that you stop the traffic or any incoming vehicle. You also need to ensure that you take the victim away from the road, from the accident scene, to a safer place where you can administer this CPR. In terms of drowning, you need to also ensure that you remove the patient from the water. If you can't swim, you ensure that you get there are so many helpers around that can assist in bringing out this victim. And you also ensure you whether this person, you ensure that you check if the person needs CPR or not. In every emergency condition, you need to also do that to ensure that you are not giving CPR to the wrong person, to avoid you causing damage to the ribs. So next is, we want to use let's say road traffic accident victim to perform our CPR. So like I've said earlier, in road traffic accident, we ensure safety by stopping the incoming vehicles and removing the victim from the accident scene. And safety can also mean ensuring your own safety by looking at the environment where this happened. If it is a case of court or cultists, you will not just go and go to a very unsafe area to say you want to start performing CPR because you have little knowledge of CPR. So you need to ensure your own safety first and ensure that it is safe enough for you to carry out CPR. Now the next thing you want to do is to check for responsiveness. This is Mr. Jones. He just had an accident, and I want to carry out a CPR after admission, after ensuring safety of myself and himself. So the next thing you want to do is to tap on his shoulder. Mr. Jones, are you okay? Mr. Jones is not responding. You tap again 2 to 3 times and he didn't respond. The next thing you call for help, and ensuring that you also tell someone to quickly call the medical team or the ambulance or the safety team for immediate intervention. But don't stop at that. You also ensure that you continue with the other process of the CPR while getting for help. Now you have called for help and you are also trying to administer the CPR. The next thing you want to do is to check for your pulse and check for breathing, so you don't administer CPR to the wrong person. How do you check for pulse? This your two fingers, this is your Adam apple, right? So just either beneath or on top, there is a groove. So you place your hand just at the groove of that your neck. So you perceive some strong pulsation. So if you don't perceive this, if you don't feel this pulsation, it actually means that there is no pulse. And when there is no pulse, it simply means that the heart function has been compromised. It's either the heart is not, pumping at all, or it's pumping but the efficiency is not strong enough. Now, the next thing you want to do, and you can also check for this pulsation, in other areas of the body, but in a severe condition like unconsciousness or any condition that would need a CPR, the best place to check for this pulsation is at the carotid artery, which is located just around the neck area. You can also check in other places, but you might not really feel the pulsation. So the best thing is to just go straight there. And you can also check for yourself. If you don't feel this pulsation, you must feel this pulsation, because if you don't feel the pulsation, you will not even be alive to watch this video. But I so you need to just do that. It doesn't take up to 2 seconds. Place your hand, you will definitely feel the pulsation. So the next thing is, we want to also check for respiration. How do you check for respiration? You look at the rising and falling of the heart, of the chest. So when you look at the chest, you observe that there is a rising and falling movement. And as you are observing the chest, you are also observing the nose. If there is any feeling of air coming out from the nose or from the mouth. If there is no pulse, you know that the heart is not functioning. So what do you need? You will need to assist the heart to pump the blood. That is why you do that CPR. And how do you perform the compression? You perform the compression. If it's an adult above 12 years, you need to ensure that you give a 30 cycle of compression. 30 cycle of compression. And 30 cycle of compression, it means you are putting your hand directly on the sternum, just around the breastbone area, the center of the sternum, and your hand must be straight. So you don't bend your hand like this while giving compression. It must be straight. Your shoulder, it must be straight, so that the force will be coming from here, your shoulder, and your dominant hand might be on top to administer this compression. So you use this, do not use this. Use this heel to administer your compression. So you just give 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, up to 30. So after 30, you would also, if this patient needs respiration, you check for respiration and you administer respiration. This is called the elbow bag. So in situation whereby there is no elbow bag, you can actually use maybe your towel, your handkerchief, or anything, and place and administer a mouth to mouth, respiration. And before you administer this respiration, you ensure that you do what we call head chin lifts. That is, you hold the head and the chin, shift it backward to open up the airway. As you open up the airway, you make it easier for the air to flow into the lungs, and you administer your breathing. You can hold the nose, pinch the nose, and administer through the mouth, or you put your mouth both in the nose and in the mouth and administer this effective breathing. So, like I said, that is when this patient needs a complete CPR. What if this patient needs just um, respiration? You administer only the respiration. If this patient needs um, just the compression, you administer only the compression. And I've explained to you earlier that if there is no pulse, it means that the heart's function has been compromised. So the heart needs an external force to help pump out blood to different parts of the body. And that is why we administer that compression. So sometimes when you check, you observe that the heart, the chest is not rising and falling, and that's where this individual needs a respiratory assistance, and you administer this respiration. In some cases, they just need the respiration. There is strong pulse, you just keep on administering your respiration until when there is a medical team or there is an oxygen around to administer a full oxygen. But in most situations, complete cardiac cardiopulmonary resuscitation is very very essential. That is the complete circle of giving both the compression and the rescue breathing is actually very very essential. So you keep on administering until a medical team, until help comes your way as a first aider. There are so many other things that can be done to this patient when they get to the hospital, but our major concern is the first aid management of any case that requires CPR. So if you have any question, you can actually ask. The comment section is open. Please ask any question. Suggest further topics that you would want us to discuss. Any topic of choice, and I'll be ready to assist. Don't forget, the best place to administer CPR is on a flat, hard surface. Do not administer CPR on a surface you know uh, where the compression will not be effective, and also do not administer CPR when the environment is not safe for administration. And you need to make sure that you continue administering CPR until a medical team comes to help you, or when you are tired. It is actually advisable for you to stop when you are tired, so we don't have two victims. And you can also stop administering CPR when the patient is back to life. How do you know that this patient is back to life? You are administering CPR and this patient suddenly coughs and start breathing normally, or this patient suddenly wakes up and start talking, or wakes up from his unconsciousness and start talking to you, or you observe that the sudden respiratory difficulty and pulse have returned. So in any of these conditions, you need to stop the CPR and seek for further help. I hope with these very few points on what CPR is all about, we are all going to be experts in administration of CPR. And this device here is known as the AED. So we are going to still talk about what the AED is all about, but that will be in another lecture. Okay, this is the AED. So in a different lecture, I'm going to tell you how to make use of the AED, and I will tell you the patients that need AED. So thank you so much for watching, and please subscribe to my channel to see more of these videos. Thank you so much. Thank you for your support, and may God bless you. Have a lovely day. Bye.